So I'm a registered nurse, and I work in New York City and Mount Sinai, Israel. So it's part of the largest health system in New York City. I'm a desk nurse. I don't really see patients every day. So when the COVID kind of crisis started happening, the initial kind of response was for people who don't have to be at work to start working from home. And so I was one of the people that started working from home. And I remember kind of thinking to myself, I feel really bad that I'm not part of that, like I'm staying at home. And that old adage, be careful what you wish for, kind of happened. April 10th, I received an email asking if I am actually able to help with the frontline response for COVID. So I said, yes, absolutely. And after I hit the email, this kind of panic, just hits me.
All right, welcome everyone to another episode of Meta Transitions. Today we have with us one of my good friends, Peterson Masigan. Peterson is one of the frontline responders to the COVID crisis in New York, and Peterson is going to tell us about his story when it comes to responding to COVID. Peterson, welcome to our show.
Hi, thank you so much for having me, Tricia.
You're welcome. You're welcome. All right, so we're going to jump right into it. Tell us what's your story. How did you respond to COVID, the news, and what was your role?
Yeah, absolutely. So for background, so I'm a registered nurse, and I work in New York City and Mount Sinai, Israel. So it's one of the community hospitals. It's part of a larger health system in New York. It's actually part of the largest health system in New York City. And my regular role isn't a frontline kind of bedside nurse. So I normally manage a program. I'm a desk nurse. I don't really see patients every day. And so when the COVID kind of crisis started happening in early 2020, the initial kind of response was for people who don't have to be at work to start working from home, that they were trying to keep their workforce safe. And so I was one of the people that started working from home and started watching kind of watching it unravel, being in the midst of it. Everything's kind of shutting down. And you can really sense there's something in the air that just wasn't right, that things aren't okay. And so we'd be watching the news and they'd show all these hospitals that are inundated and overwhelmed, especially around March, April. Yeah. And I remember kind of thinking to myself, I feel really bad that I'm not part of that, like I'm staying at home and all my colleagues who are nurses are kind of going in and really risking their lives. And that old adage, be careful what you wish for, kind of happened. And so April 10th, I received an email from the chief nursing officer for our hospital asking, if I am actually able to be reassigned, redeployed from my normal duties to help with the frontline response for COVID. With all of the nurses and other healthcare professionals getting sick, we were really starting to lose a lot of our frontline workers, particularly with regards to nursing leadership. So our nurse managers were starting to get sick with COVID. And so they were starting to kind of having to take time off. And, it's so funny now that we think about 2 weeks. It's never 2 weeks. People who are out of COVID were out for at least a month, kind of given the severity of the illness and kind of how each person's body reacts to it. And, the average age of the nurses and the nurse managers in New York anyways is kind of in their 40s, 50s. So, people kind of starting to get a bit older, a bit more comorbidities and health problems. So when it hits them really hard. And they decided to convert one of the units in the hospital as a COVID unit. So it's where the patients are too sick to go to a regular unit, but they're not quite sick enough that they needed to be intubated in the ICU. So it's kind of like a mini step down. And the manager who normally manages that unit was actually out as well with COVID. So that's, given kind of my background in nursing, I used to work in the emergency department. So having kind of that background of knowing how to help patients in kind of the acute kind of respiratory distress and whatnot, they thought that would be a good place for me to be. And it's funny because I remember saying, well, I mean, I don't think I really have any choice, and it's kind of, this is kind of what I signed up for, to be healthcare workers, to help people. And so I didn't give it much thought. So I said, yes, absolutely. I can start tomorrow. Let me know where to show up. And after I hit the email, this kind of panic,
I can imagine.
just hits me.
Yeah.
It just hits me. And I'm like, we didn't know anything about it back then, right? We didn't know much about it. We knew it was bad. We knew it was serious. We knew people were dying from it. And, when they told me that I was going to be basically every single patient in that unit was going to have COVID, and they're all going to be in this machine that basically aerosolizes the virus. I was like, oh man, like this will be interesting. So, I had to have a conversation with my partner about, do I, what's the word, quarantine myself? Do I live in the hospital? Do I stay here? Like, how do we navigate this? Because, like when you're in a partnership, you kind of have to think about the other person.
Yes.
So we kind of decided, I think we'll just do our best to, to take the precautions required. So, now we kind of think back and laugh at kind of the memes of people kind of, like undressing outside their house and kind of, all that stuff. But that really was what was happening, everything that was going to enter our place after work. I had a whole routine where I wore only the scrubs at the hospital. I wore different shoes that never left the hospital. And when I would come here, like I don't pass the threshold without like really like stripping to my underwear outside in the hallway of our apartment before I come in, and everything's kind of bagged because we just didn't know, right? And these aren't even clothes that I was wearing caring for patients. These were clothes that I would go to the hospital, sitting in the subway, and then when I get to the hospital, I would change, but we just didn't know. So that sort of thing. It was really interesting to kind of be in a space where you had to care for other people, you had to think about other people, but at the same time, like truly wondering, like, am I going to survive this myself? So it's quite a journey. I was deployed for just under 3 months, and at some point, I remember like just almost leaning into it. Like I was just sheerly exhausted by the anxiety that came with this day, the day that I'm going to catch it. Like I remember the very first day that I was in the hospital, and I went in to help a patient, and I put on my PPE, but unfortunately, it's been years since I've worked at the bedside. I kind of had everything on: my mask, my gloves, my gown. And then I had the visor kind of up here, and I figured when I go into the room, I would pull it down.
Yeah.
But as soon as I got in, she was coughing, so I kind of ran over, and I bent over, and she just started coughing into my face. And then that's when I realized that the visor, that I didn't have it down, and so I was basically probably getting like viral particles in my eyes. And I'm like, and I remember thinking, oh my goodness, this is it. Literally, like it's not even 8 a.m. and I'm oh, this is it.
Mm-hmm.
But by the grace of God, I'm gonna use the word survived. I survived the whole ordeal without ever contracting COVID. I went through some serial blood works after my reassignment was done, and I was back to my old job, and it never showed that I was actually exposed to it. So I, kind of thinking about the context of where I was placed, how close I was caring for these patients. I was spending 12 hours a day, 5 days a week inside these rooms, and the fact that I never actually contracted the virus, symptomatic or asymptomatic. It's just kind of really
Yes.
divine intervention.
Yes.
Yeah, so that's kind of that part of that transition piece of where I was and where I was kind of put elsewhere and back again, and it's
Mm-hmm.
interesting because this second bout in the winter time, they opened the unit again, and they
Okay.
approached me and said, like we really appreciate you helping us in the spring, and I hope we can count on you. And I was like, oh God, please no, like
Here again.
I don't know that I can handle it.
Yeah.
Like
Yeah.
I I'm a hard worker. I don't
Mm-hmm.
shy away from hard work, but
Mm-hmm.
it's the anxiety.
Yeah.
It's that uncertainty of, is this the day? Is this the day that I'm going to catch it? Because this was before we had the vaccines. So I remember kind of thinking, so I'm fessing up to something. Oh my goodness.
Mm.
I remember they called me on a Tuesday, and then I called my medical director, and I'm like, doctor, you gotta, they're asking to reassign me again. And she's like, absolutely not. We barely survived without you managing the program for 3 months. We're still behind. It's November, and we're still behind from when you were gone. No, we there's got to be a different way to help with the frontline response. That's just not going to fly. The manager's back. I don't see why they would need you again.
Mm-hmm.
And then around the same time, the vaccines have been approved. We were looking at how to roll it out, and so I kind of thought, well, I know how to give vaccines. Maybe
Yeah.
that would be kind of a less stressful way to be a part of the COVID response for New York. So I approached the vice president of HR and said, I heard that you guys are looking for folks to help with a vaccine pod. My director thinks that this might be a better avenue because it's not going to be as involved. If I'm just sitting there giving vaccines every day. And he said, well, what could you do? I said, well, I can, as simple as being a vaccine nurse and sitting there and giving vaccines, or I could manage the pod because I do have management experience. I used to manage an outpatient clinic. And so when he heard that, he's like, actually, yeah, I think that would probably be the best fit given your experience. And so why don't we set that up? And again, be careful what you wish
Mm-hmm.
for kind of
Mm-hmm.
happened, because I ended up having to work like 6:30 a.m. to 8 p.m. 5 days a week, and then the odd weekend shifts from mid-December up until the end of January. That was kind of my life. It was so it wasn't, the anxiety wasn't around. There was no anxiety, actually. There was no anxiety compared to prior, when I was, taking care of COVID patients, because, at the time we were only vaccinating healthcare workers. It was essentially a restricted zone. It was in a part of the hospital that you have to be an employee to get to. But then the exhaustion piece of working, 15-hour days, often not having kind of time to eat. And it's so funny because I remember for weeks after that, people would come up and be like, "Oh, Peterson, you've lost weight. You look great." I'm like, "What did they, have you been like eating better, working out?" I said, "Well, just not eating at all, probably."
Yeah. Yeah.
That does it. They're like, "Yeah, you look like you're always running around." And so it was kind of interesting to see the other kind of what do you call this, the other side of that it's you don't have the anxiety, but now you have this physical exhaustion. Not that the other time wasn't physically exhausting, but this definitely was. So it was just kind of a really different experience. But it was also really rewarding to know that I was part of that. It's kind of like we talk about it now as being part of history,
Yes.
being part of that. I remember one of our cardiologists, he's in his early 70s, and he's coming into work, and everyone said, "You don't need to do that. You can work from home. You can see your patients remotely." And he's like, "I don't want to miss this. This is once in a lifetime. This is history in the making, and I want to be a part of it." And I remember thinking, what a way to contextualize disaster and grief and pain and a very scary moment in our lives, to kind of talk about seeing the silver lining, and I think part and parcel of that, maybe the wisdom of age.
Yeah.
I'm sure that doctor's seen a few things around the block. And so I think really to kind of view it through that lens, it was really inspiring. And so I think that definitely kind of fueled us to keep going and to give of ourselves, it really was. Yeah.
Okay, wow. Thank you for sharing this with us, Peterson. Now I'm sitting here listening to you and I'm like, okay, I'm not going to stop him. Generally, I would like do like a little pause in between and sort of do the summary, but I was just like, no, this is too good to interrupt, right? And I was just there listening and I'm like, wow, the idea of us, being on the sidelines, because I just see us as on the sidelines, right? Just, putting our lives into your hands, really. Right, as healthcare workers, and now I'm listening to your story. I feel like I'm getting the inside scoop, of what was going on, and I can't imagine the anxiety like you're talking about for that first time around, wondering if you're going to get the virus, and that constant, uncertainty of, is it going to be today, is it going to be today, right? And it's wonderful to hear that you went through the whole experience and you didn't, contract the virus at all, which is, as you say, divine intervention for sure. Where we heard news of so many, nurses and doctors and healthcare workers who, didn't make it, right? They put your lives on the line and they didn't make it. So I'm really happy to hear that you are still around and you're still, there to serve. And I'm hearing your heart as well. I completely understand when the second time came around, you're like, it's just not within your capacity, to serve in this way again. It makes sense, right? Because you went through what you went through the first time, and to still think about, okay, how can I serve, still wanting to be able to put yourself in a position to still serve, and you're able to, as you say, find another way to give of yourself, but this time around, hard work never comes without, in Jamaica they call it, your nose running, right? So this time it wasn't anxiety, but it was exhaustion. And it makes sense, it's the other side of it. If you're not extremely anxious about your life, within sort of this life-threatening situation, you're working really hard, right? Long hours, day in, day out. And I know sort of nurses' schedules, because of that exhaustion on a normal, scale. It's sort of like you're generally on and off sort of thing, right? But this, what I'm hearing is like almost every single day, right, for long hours. So I could see how that would have been even, more difficult for you to have gone through that. So thank you. Thank you for, the work that you've done and that you're still doing to help to, I don't know if eradicate this virus is a right word. I would love to say eradicate this virus, but I know that that's a long way from what really, is in reality at this point. So maybe the next question I could ask you is, maybe how has this impacted your life, when you look at, I guess, the future? Um, if you could say there's any transformation moments, what would that be?
Um, I think a big part of it is, and I'm sure this is not something that's revolutionary or new. I think this is something that we hear from a lot of people,
Mhm.
is really kind of taking stock of what's important, of who's important, what matters. I think kind of going through, even without the experience that I've had at work, just kind of going through this pandemic. Um, yeah, like kind of learning of yourself. What do you hold as important? What do you hold as dear? What are you willing to do for that? What are you willing to give up? I think um, that's kind of, for lack of a better word, and I use the word loosely, blessing in going through this, is that it's allowed me to step back and realize just how what's the word, unsustainable our current pace of life was before the pandemic. The decisions we make, the things that we hold of value, and the things that we give up to maintain the things that really now I'm seeing as that's not at all important, and also the things that I take for granted. The flip side, is that those are sometimes the things that really what I hold dear. I think about relationships, I think we take for granted beforehand how easy it is to just connect with people. And now that we are forced to be apart from each other, I kind of think, who do I want to spend my time with? Who is worthy of my time? And also the important people in my life. Like, have I honored them enough to spend the time? I think, this, but people who are viewing this will not know. So we met in Vancouver. So I'm from Vancouver originally, and I moved to New York. And I don't have any family here. I don't have any friends here. I moved here. My partner moved here from school. And so all of my friends, all of my family are in Vancouver. And before I moved, I remember my dad pulling me aside and saying, I know you'll be fine. I've trained you. I know you're going to be fine in New York. Can you do your mom a favor and just check in twice a week? Because she needs to know you're alive. She needs to know you're okay. And I did that, initially when I moved here, before I met people, before I got involved at work, I called my parents often. And as I got embedded into the daily kind of grind of living in a big city, I still tried to call my mom once a week just to kind of check in and let her know I'm alive. But I remember there was moments where sometimes a week will pass, and I'm not sure what it's like with a Jamaican mom, but with a Filipino mom. And I think I'm sure you're going to agree. They always ask why you didn't call.
Yes.
And then it's
Yes.
like, your phone works to call me as well. But it's not like, I think it's an ethnic mom thing, isn't it?
Like, I completely agree. This is the exact question.
Do you get the same treatment?
Yes.
See?
Yes.
And it's funny because my brothers and I, we talk about it. We're like, mom always, when I call my mom, she's like, oh, you're the only son who calls me. And I'm like, mom, why don't you call them? Oh, well, they might be busy. And I'm like, well, then they don't answer the call. And then they see you call them and you call. But there's no effort. And I know for a fact it's not because they don't love me. It's not because they don't want me. It is a weird cultural thing that it is, the onus is on us as the children to reach out.
Yeah, it's like an expectation.
And so,
it's an
yes,
expectation that, I brought you up, you've gone out into the world, you need to check in with me.
So it's not just the Filipinos that's doing it.
No. Jamaicans are doing it too.
All right. So, I remember the first few months, we would be on FaceTime every day, and I think just the idea, the experience of seeing each other and, okay, today we are all alive. Today we are all alive. It really has taken on that. It wasn't something that I'm like, oh, I can do it tomorrow. It was like, I was looking forward to spending time with my family, even every day. I mean, it also helped that there was nothing to do. At the time, New York was closed, really closed. I think that's part and parcel of what I've discovered through the last year and through the transition and the changes that the world has gone through and that I've gone through, is that it's a cliche, but I think it really resonates with me that that ability now that I have coming through the fire, through the other side of taking the time to think, what I'm doing important? Is what I want? Is my goal important?
Mhm.
And really contextualizing it in a time where, when you hear the words "life is too short," isn't just a trite saying anymore. When it really is, life is too short, and we can't guarantee that we'll be here tomorrow. And I think going through what I went through really contextualized that to a very real context. Yeah.
Yeah. No, it's I'm listening to what you're saying, and the same thing happened with me, right? There's sort of this idea of, it puts you in this space of needing to figure out, who and what's important to you. And I think that's what I'm hearing from you. You recognize the community, so important.
Yeah,
Because it's the
absolutely.
idea of losing community that makes it so important, right? This virus
Yeah.
has made it so it put death in your face, in a sense, right? The
Yeah, it really did.
possibility of death. So you could die, your family could die. So you're like wanting to seize the day. Like every day you want to connect because you're, scared that something could
Absolutely.
happen to anybody. And it's great that, your family is still around and you're still
I
around.
know.
God's
We're
good.
very lucky. God is very good. Yeah.
Yeah, yeah, not so many were lucky, right? So many lost their lives. Like on our
And we're
side,
still losing
we,
it, you know?
yeah,
You only have to look at like India, and
yes.
I actually, it's funny because this morning I spent some time speaking to a friend of mine who lives in India, and he was telling me that every there's no there the things that we see in the news is not sensationalized. It's not made to look bigger than what it really is. That he was sharing with me that his dad just tested positive for COVID, and is positive for COVID pneumonia, but they went today to the hospital, and there's no room, and so they're gonna try again tomorrow. And it was just like baffling to hear that. Like, what do you mean you went to the hospital? They know they need to come in, but they can't. So you have to take him home and then try again tomorrow. Like, it's not like.
Wow.
And yeah, so I think what we're lucky that it's controlled. I mean, like you said, it's not eradicated, but it's controlled where we are. But everywhere else in the world, death is still, in the face of people, in the midst of people. And yeah.
Yeah, no, we're definitely privileged here in North America for sure, for sure. And
Absolutely.
and that, I think that's what I was gonna say. Like I have, my in-laws in India right now, and we've had maybe 3 deaths so far,
Oh my
right?
goodness, I'm
So
so
it's
sorry.
really, yeah, it's rough, right? It's rough. So what I would say, generally what I do now is I ask how people can contact you, but I don't know if that's a good idea. Maybe what you could share are maybe some contact points where people could get information, maybe about COVID in their area. What would be? Is there like a 1-800 number? Is there like a website or something like that that people
Yeah,
could
I
go
mean,
to?
so where I am in New York, 311, I think in Canada, in Vancouver, it's
Mhm.
411. So here it's
Yes.
311. And it really is a one-stop shop for all sorts of resources and support, like literally anything that you want to know about, the person answering the phone can direct you. So like if you had
Mhm.
questions about COVID, if you had questions about the vaccine, if you had questions about mental health, if you had questions about finding a place to live, like it's that one number, 311. So in New York City, I'm imagining in Vancouver, it's 411 is probably the number for kind of general information, and then for health information, I believe it's still 811. I don't think
It's
that's
still eight
changed.
one one. Yes.
So yeah,
Yes.
so if you have any kind of health questions, I, it's funny that you brought that up about resources, because I think a caveat that we really need to kind of bring up is the reliability. of the sources that we get our information from. I think it's important to know how to assess kind of something that you hear or you see, especially online, especially on your Facebook feed.
Oh, trust me. And in the WhatsApp groups.
In the WhatsApp groups, same time. Oh yeah. So I think just as important as knowing where to find the information is either having some basic skill set on how to assess a web page or an information you're getting to see whether it's accurate, whether it's reliable, versus something that might be a clickbait or something that might be kind of rooted under conspiracy theory sort of things that might actually be doing more harm than good. And so kind of having someone that you can trust to kind of run that information with. Usually I would say someone, if there's a healthcare professional in your life, they may be a good resource to run that through. I would say, I think the CDC for each individual countries, wherever people are listening to, most countries have a CDC, the WHO. Those are usually very good sources for information with regards to COVID, regards to mental health. They rely on many different scientists to kind of look at an information and kind of come to a consensus to say whether this is good or not. So those can be some general information I think would be a good place to start. But I really want to stress the fact that the quality of the information you're finding is just as important, because I remember last year people were drinking bleach. They were taking a medication that sounds similar in name to the medication that the hospitals were using to treat COVID patients, and they themselves getting poisoned by it. Jeez. And so it's just as important to know where to find good information, reliable information, and who to turn to if you're confused about what you're seeing, if you're confused about what you're hearing.
Yeah, no, I completely agree. Stressing that importance of where you're getting the information from and the quality of the information is really important. So if I heard you correctly, for New York, it's 311, for Canada, 411 and 811. Whereas we're, I guess, going to websites, it's CDC for each country and WHO for, I guess, a world organization. And I know specifically for Canada, for our Canadians, you can definitely go to Health Canada and you can get some information there as well. But again, if you don't have access to all of this and you have a healthcare person in your life, please run, anything you hear or read on WhatsApp by that person to see if it's trusted information. Yes, definitely.
Absolutely.
Well, thank you so much for being with us, Peterson. It was lovely talking to you and to reacquaint ourselves and, to talk about this, as you say, something that is going down in history. Like that doctor said, I agree completely. We are a part of history and you're a part of history. And thank you for your service.
Thank you for having me, Tricia. It's very good to see you. It's been years, I know.
Yes, it has. Take care and see you next time.